Hello and welcome. Today, we're delving into the world of ear health, specifically exploring a condition called cholesteatoma. While it might sound intimidating, understanding what it is, how it develops, and what can be done about it is crucial for maintaining healthy hearing. Let's embark on this informative journey together. So, what exactly causes cholesteatoma? It's not a disease in the traditional sense, but rather an abnormal skin growth in the middle ear behind the eardrum. The most common cause is eustachian tube dysfunction. This tube connects the middle ear to the back of the throat and helps equalize pressure. When it's not working correctly, negative pressure builds up in the middle ear, pulling the eardrum inward and creating a pocket. This pocket can then fill with dead skin cells and other debris, forming a cholesteatoma. Other less common causes include congenital cholesteatoma, present at birth, and rarely implantation of skin cells into the middle ear following surgery. Now let's look at how cholesteatoma develops. As we mentioned, negative pressure creates a pocket in the eardrum. This pocket acts like a collecting ground for shed skin cells, earwax, and other debris. Unlike normal earwax, this material can't be easily expelled. Over time, it accumulates, forming a mass. This mass isn't just an accumulation of dead skin, it also produces enzymes that can erode the surrounding bone, including the tiny bones of hearing in the middle ear, the ossicles. This erosion is what makes cholesteatoma so dangerous and can lead to hearing loss, balance problems, and even more serious complications. Cholesteatoma isn't terribly common, but it does occur. It can affect people of all ages, but it is more frequently diagnosed in children and young adults. Individuals with a history of chronic ear infections, eustachian tube dysfunction, or cleft palate are at a higher risk of developing this condition. While precise global statistics are difficult to obtain, studies show a prevalence ranging from a few cases per 100,000 individuals in the general population to higher rates in specific groups. The signs and symptoms of cholesteatoma can vary depending on the size and location of the growth. One of the most common early symptoms is ear drainage, which can be full smelling. You might also experience hearing loss, often starting as a mild decrease in hearing that gradually worsens over time. Other symptoms can include a feeling of fullness or pressure in the ear pain, dizziness, and balance problems. In severe cases, if the cholesteatoma erodes further, it can cause facial paralysis, tinnitus ringing in the ears, or even spread to the brain, leading to serious complications. Diagnosing cholesteatoma typically involves a thorough examination by an otolaryngologist, also known as an ENT specialist and ear, nose, and throat doctor. The doctor will use an otoscope, a lighted instrument, to look inside the ear canal and examine the eardrum. If a cholesteatoma is suspected, further tests may be ordered. These can include a hearing test audiogram to assess the extent of hearing loss and imaging scans like a CT scan or MRI to visualize the cholesteatoma, determine its size and location, and identify any bone erosion or other complications. While cholesteatoma can sometimes be categorized based on origin as congenital or acquired, the classification isn't as crucial as assessing its size, location, and extent of damage. Surgeons and ENT specialists primarily focus on those factors when planning treatment. They will use terms to describe whether the growth is small and localized, or large and involves critical structures. For instance, the primary treatment for cholesteatoma is surgery. The goal of surgery is to remove the entire cholesteatoma to prevent further damage and recurrence. The specific surgical approach will depend on the size and location of the growth, as well as the patient's overall health. In some cases, the surgery can be performed through the ear canal. In more extensive cases, an incision behind the ear may be necessary. The surgery often involves reconstructing the ossicles, the tiny bones of hearing, to improve hearing. Following surgery, regular follow-up appointments and ear cleanings are crucial to monitor for any signs of recurrence. In some cases, a second surgery may be needed. Unfortunately, there's no guaranteed way to completely prevent cholesteatoma. However, prompt treatment of ear infections and good management of eustachian tube dysfunction can help reduce the risk. Avoiding exposure to loud noises and protecting your ears from water during swimming can also contribute to overall ear health. If you or your child experiences recurrent ear infections or persistent ear symptoms, it's essential to seek medical attention promptly. The prognosis for cholesteatoma depends on the extent of the growth and the success of surgical removal. With timely diagnosis and treatment, the vast majority of patients can achieve good outcomes with resolution of the cholesteatoma and improvement in hearing. However, recurrence is possible, so long-term follow-up is essential. Current research is focused on developing less invasive surgical techniques, improving hearing outcomes following surgery, and exploring potential medical treatments to prevent or slow the growth of cholesteatoma. Gene therapy research is also ongoing, looking for ways to prevent the formation of these abnormal growths at a cellular level. This is a continuously evolving field with the potential for even better treatments in the future.